Yes.
Thank you. Yeah.
Well, good evening, everyone. This is the League of Women Voters of Florida's Clean Energy Action Team meeting for February 21, 2024. Tonight, we are very pleased to have the founder and I think CEO of an innovative nonprofit here in Florida. Her name is Dr. Catherine Toms, and she is going to tell us all about how this came to be and how it's working today. The nonprofit is called Green Cars for Kids. Dr. Toms.
Thanks so much, Mary, for the opportunity to talk to you all about Green Cars for Kids, for the invitation. Thanks to Susan Steinhauser for the connection, and Dory Larson also for mentioning us in her presentation. Dory is on the board and really adds a lot of her expertise. And I have to say that Laura, shout out to Laura and Son. I was the beneficiary of the last Sun Co-op in Palm Beach County, and we have great solar panels on our roof that are fueling our cars too. So I love Sun. They guided me when I really had no idea what we were doing in choosing a provider. So that was really helpful. I'm a public health physician, and my past experience developing interventions that addressed maternal and child health and tried to reduce infant and maternal mortality sort of coincided or combined with my interest in climate and health, especially extreme heat exposure, especially with pregnant women and children. And so this idea sort of developed from those two focus areas of mine. And Green Cars for Kids is not an original idea. I lived with my family in Birmingham, Alabama for 17 years before we moved here in Delray Beach. And there is a wonderful man who was a firefighter. This started an organization that's been around for almost 27 years now called Kid One. They do exactly what we do, which is providing free transportation for low-income expectant moms and kids to healthcare visits that they would otherwise miss because they don't have transportation. The only difference is we use electric cars. So that's us in a nutshell. And so what's the problem that we address? So childbirth in America is risky for both moms and babies. And according to a report by the Commonwealth Fund published not too long ago, American women have the highest maternal mortality rate compared to similar high-income nations. There are also disparities in that Black women are more than twice as likely, in some areas 3 times as likely to die due to pregnancy complications than the national average. So newborns also are facing difficult odds in the US. So our mortality rate outpaces infant mortality among economically and socially similar countries as well. And according to the March of Dimes, 2 babies every hour of every day in the US die. And about every 12 hours, a woman dies from pregnancy-related causes in America, even though we have the highest national GDP in the world. So what does it look like a little closer to home? So this is just a printout from the Department of Health's website. You can access all kinds of data about your county, wherever you are, and Florida. So just look at the general curve and know that Florida is the orange and, no, wait a minute. The Black women are orange and yellow, and Florida is the lighter line, and Broward County is the darker for Black women, and then white women, those are the blue lines for Florida and Broward County. They're very similar. And you can see that there are stark racial disparities that are really driving these bad birth outcomes in the US. Uh, Let me just briefly show you this slide from Miami-Dade County. As I said, so I'm in South Florida and I'm working in these counties right now with Green Cars for Kids. So that's why I'm a little focused on that, but you'll see the same general trends there. And so in those two counties, Miami-Dade and Broward, 33 women died from pregnancy-related causes in the last 3 years that the Department of Health has records for. And really, most of those deaths, over 80%, are preventable. So let's just delve into what the problem is. Why is childbirth so dangerous in America for both moms and babies, even though we do have the most sophisticated and expensive health system in the US? So, two of the leading causes of infant deaths in America are preterm birth and low birth weight. And it's the leading category for infant deaths among Black infants. So the March of Dimes publishes a report every year, and they reported in 2023 that about 1 in 10 babies are born preterm in Florida, and about 1 in 11 has a low birth weight, so putting them at risk. And these persistent health disparities, racial disparities, lead to increased costs for health systems, for families, and for us, the taxpayer, when you consider that about 45% of births in Florida are Medicaid supported. And the March of Dimes has done a study to estimate the annual societal cost, wrapping that all up together, of preterm birth, and it's over $25 billion annually. So here's a little shot of prenatal care in Florida. And of course, it's a complicated issue, and there are a lot of reasons for poor birth outcomes, but we really need to delve into them and understand them before we can really tackle them with effective interventions. So one of those reasons is lack of prenatal care. And according to HHS, babies of mothers who do not get prenatal care are 3 times more likely to have a low birth weight and 5 times more likely to die than those born to moms who do get adequate care. So that is something we can really improve, right? Because if all women have access to early and effective prenatal care, we'll probably improve these birth outcomes. So we also know that low-income women in Florida and in the US are eligible for Medicaid coverage as soon as they know that they're pregnant. So what is preventing them from getting this prenatal care? So you all probably, because I'm among a group of very well-educated and aware women, that these are social determinants of health, things like housing, transportation, education. They're also referred to more recently as health-related social needs. So they're positive and negative social and economic factors that really impact our health. And of course, transportation is found to be a considerable barrier to health in Florida and in the nation. So regardless of insurance, a study showed that 4% of patients in the US, including 3 million children, miss a healthcare visit each year because they don't have transportation. That includes 9% of families with an income under $50,000. So these missed appointments lead to increased health expenditures, delayed care, and poor health outcomes. Go on to the next one. So I know you guys are from all different parts, the Orlando area, Winter Park, on the West Coast. So you do have a few, let's see, is Orlando, the Orange County on there? No, unfortunately. But there's some of your counties on here. I circled Miami-Dade and Broward again because that's where I'm working. But you see that quite a few households don't even have an automobile, and in a very automobile-centric society like the US, that's a real barrier to healthcare. And we know that often, if there is public transportation, it's inadequate with long wait times and multiple connections. I've heard many stories from moms about how difficult it is to really use public transportation. And the Nicholas Children's Hospital did their community health needs assessment report that all nonprofit hospitals have to do every 3 years. And that report tells us that over 73,000 children in Miami-Dade County and almost 47,000 children in Broward face barriers to healthcare because of transportation issues. So here we've clearly identified a transportation gap as a major cause or a major opportunity to address healthcare utilization and these poor health outcomes in maternal and child health, but also in all areas, all different kinds of people when it comes to health. It's not only something specific, but this is the area that I'm focusing on. So I just want to slow down and take a break right now to kind of delve into the program and tell you a little story about Stephanie. So this is Stephanie. She enrolled in our program at Broward Health's Corey E. Brain and Family Health Center in the summer when she first learned she was pregnant. She didn't have access to transportation, and she didn't have childcare for her older daughter. So she had, it was difficult for her to make her appointments. So with us, Big Sis was able to ride with her mom in a car seat that we provide, installed by our drivers that are trained to install car seats by Safe Kids International, the gold seal of car seat installations. And I took the course. It's really hard. You would never believe how difficult it is to put in all those different car seats. And because transportation wasn't a burden to Stephanie any longer, she made all her prenatal appointments. She had an uncomplicated pregnancy and delivery, and mom and baby returned back for their well baby check and follow-up postpartum visit there. So what we do is we provide 50 hours a week of door-to-door service in a year to the funder. It can be any kind of funder, a foundation, healthcare facility, or a private entity. It can be like insurance company, or even the auto industry is a good target. I'm also applying for federal grants and state funding. So we use an all-electric transportation service provider, and you all maybe know them because I know they offer services in Delray Beach and other parts of South Florida and over on the West Coast in St. Pete. It's called Freebie. So they only use electric cars, and they provide a Tesla for our riders because they're really special, and we want to make sure they're super safe. Let's see. And so any funder can wrap the vehicle. Our pilot program provider was, or still is, the March of Dimes. They are an amazing partner, and I just can only sing their praises. So you can wrap the vehicle if you're funding the project for marketing purposes or just for awareness. And we have a portal that the scheduler at the clinic uses. I'll show you the portal on the next slide. And we provide seats, car seats, and I said the drivers are trained. And we also have a little electric tablet, like an iPad in the back that moms and parents can use to access videos that are provided by the March of Dimes. But I've also been talking to Miami-Dade Office of Resilience about using their heat awareness videos in the back of the car and other information. Jackson Memorial is going to be posting their videos that are specific to hypertension during pregnancy. And they can just get all this information as well as social support, information about social support, like how can I get more affordable housing? Or is there a service that can help me weatherize my home or help me pay for an air conditioner? So on those very hot days when I'm at risk and my family's at risk for heat related illnesses, we can be safe. So I'm just going to skip on after that and show you. This is just a screenshot of the scheduling app that Freebie designed just for Green Cars for Kids. And here's a little picture of the car. And as the real car drives around, our scheduler can look at any time and follow it on the map to know why are they a little late, where are they, if the clinician is running late, which often happens with appointments, then they can also know, well, that, you know, they're not yet here, it's fine. Bridget is one of our drivers. Everybody loves Bridget. So you can see which driver is driving at the time, and you can schedule way in advance or right up to the last minute. Sometimes things happen, like babies are born and we need to switch our tactic. And then if that's possible, we can quickly schedule someone else in, because demand is far exceeding what we can match with one car. So we're working with the March of Dimes to ramp that up in Broward. So here are just quick results. I won't go through everything, but I do want to tell you about Melange. She's there with her newborn, but you can only see her cap there because I'm a terrible photographer, but she's there. And they were also there for their follow-up checkup, their well baby checkup and postpartum checkup. And she was in the program from the minute she learned that she was pregnant. So 60% of our clients live in really underserved areas of Broward County, Lauderhill and Lauderdale Lakes. For those of you who, Susan, who know the area, you understand that well. And all our riders are transportation disadvantaged. They are deemed eligible through the clinic that knows them best and knows their situation. So almost 90% are Black, almost 9% are Hispanic, and the other almost 2% are Asian. And most of them, over 60% speak Haitian Creole, and then about 7% speak Spanish and the rest English. And there you can see they're primarily going to the prenatal clinic, but they go, some of the kids, not just infants, go to the pediatric clinic, and we have some high risk patients that are the ones most likely to deliver preterm or have complications. So we are, and I don't usually brag too much, but a lot of times people will say, well, why don't you just take Uber or Lyft? Hospitals have vouchers. We are just better than Uber and Lyft and other non-emergency transportation services, because we're uniquely designed to meet the needs of these low-income moms and families and children. So I went through the things about, I think I went through everything about the car seat and the video screens. We will move on. So this is our project. We're expanding to Miami-Dade County and continuing the pilot project in Broward County with Broward Health. And we've given it a new name. This is, I'm getting a lot of support from the Health Foundation of South Florida working on this project. And Deborah Anand gave it the name Free Baby. And I just love that. She's clever. And so the project will be 24 months because we found out, 9 months of pregnancy and then a year follow-up, we really need 2 years to fully assess the value of the program, right? And it works out to about right under $30 for a one-way ride. And I think that keeps us pretty competitive with other transportation services. And this is our very first rider, and another one of our drivers, Joanna. On one of the hottest summer days on record, we found out. And last December, Joanna called me with exciting news to tell me that one of her favorite riders had given birth to a healthy baby girl who delivered at term. And the big news was that the mom named the baby Joanna in her honor. And I think stories like that really tell what we bring to society more than numbers and data. So I'm going to try and quickly go through this because this is a really important part of the program that I haven't mentioned. So we use zero tailpipe emissions vehicles, or battery electric vehicles. And so what does that really mean? It means that we don't produce air pollutants or smog or greenhouse gases locally. And that benefits all of us, especially low-income neighborhoods that are historically exposed to higher levels of air pollution and climate impacts. And so because of the unique physiology of pregnancy, expectant moms and their unborn babies are especially vulnerable to environmental hazards. And my friend Bruce Bakar and colleagues produced a very large 32 million birth study that was published in JAMA in 2020. And they found that women exposed to high temperatures and air pollution are more likely to have premature, underweight, and stillborn babies. And of course, not all women are impacted equally. Black women and women with asthma, which is a very logical conclusion, are more affected. So this just shows that women and children are the canary in the coal mine for carbon pollution. And because carbon pollution affects all of us, and there's no safe level of fine particulate matter for us. The EPA just set lower standards, but medically it harms our health. We just have had trouble measuring it and documenting it, but we do know that it does impact us, causing heart disease, heart attacks, exacerbating heart disease and lung disease and other illnesses. So the American Lung Association, I'm sure you guys are familiar with it, has every year a State of the Air report. For some reason, this slide I didn't update, but it gives us 2022 results. Miami-Dade had a C rating, and more than 40% of Americans are living in places with failing grades for particle pollution and ozone. And of course, there are disparities. So this is a very positive slide. And it would be interesting if Brooke is going to use this same slide that shows the benefits of transportation electrification. So we would reap almost $1 trillion in health benefits, avoid almost 90,000 premature deaths and over 2 million fewer asthma attacks, and over 10 million fewer sick days from work by 2050 if we transitioned rapidly to electric vehicles, all of us. And this is a more recent graph really showing we all thought that this was the case, and now the data is clear. NASA and NOAA agree, and the European Union scientists, that last year was by far the warmest global year ever recorded. And the last 10 years have been the hottest years on record. So we see it's an increasing trend since the 1980s. And it's predicted that by the end of the century, we will continue to see warmer, wetter weather. and sea level rise. So we clearly have to work together to reduce our dependence on fossil fuels. And that's why we love Sierra Club and you all and Solar United Neighbors too, because it takes a village. So here, I'm going to try and wrap it up quickly. This just shows from the Congressional Budget Office, the most recent that I know of sector greenhouse gas emissions. And as you see, transportation leads the way because finally, for power companies, it's becoming very cost effective to use renewable energy. So they can't really stick too much longer with natural gas or coal. And here you see the most recent that I know of emissions calculations for both Miami-Dade on the left and Broward over here on the right. For Florida, the transportation sector accounts for 50% of greenhouse gas emissions. So it's a biggie. If we can tackle that, we will hit a lot. And if we can combine that with energy generated from renewables, then we've really made a dent on our greenhouse gas emissions, and Florida can be proud. So this is a quick wrap up, my last slide. So what we do, we provide free transportation for pregnant moms and children to essential healthcare services using electric vehicles. And so we aim to improve health outcomes for both mom and baby, to reduce costs for hospitals because no-shows are very expensive, almost $300 for each missed appointment for every clinic. And that really adds up to, I think, about an average of $3 million a year for, average size clinics. And we aim to improve air pollution and reduce carbon emissions, short-term and long-term. And we support economic growth and equitable transition to transportation electrification. And I am very grateful for you all sitting through my presentation, and I'm happy. I would love to get your opinions and answer any questions, because I find very often when I have a discussion, I discover some new idea or new perspective. So I'm happy to open up the floor for any conversation.
That was fabulous. Thank you. Very, very interesting, fascinating presentation. Okay, I know we've got questions for Dr. Toms. Maxine.
Just a real quick question. Toward the end there, you talked about Congressional Budget Office figures, transportation being responsible for 38% of, I'm not sure if it says share of energy related. I couldn't quite get it. It was too fast. And then the next slide, I wondered if did that come from Congressional Budget Office also, where it shows that transportation is responsible for 50% of the emissions in Florida?
No, hang on. Let me check that out. It didn't.
I just wanted to go get it myself, so like I want to use it.
Let me
Okay.
find it for you. Let's see.
There's a terrible bill going through the state's Senate and House right now.
You know where I
But
think that was from? I'm gonna put these links. I think it's from the from the EIA. I have these links here. I'm just gonna pop them all. That one's from Miami-Dade. I'm gonna pop all of these in the chat. I think
Thank
it's
you.
the second one.
And
Okay.
it could be
I'll
Department
figure
of
out.
Energy too, DOE.
And
Okay,
we'll ask Catherine for her slides and will distribute them so we can track
great.
that down. But
Thank you so much. This is great. This is great.
we do have
Sure.
a question.
Knowledge is power.
We do have a question in the chat from Gioti. I apologize if I'm not saying that correctly. Palmer, she's interested in, has this been tried in rural areas?
You are, hi, GOT. We've been on calls before. Hang on, I can't find, I don't want to forget. See, I have trouble sometimes finding that little white dot in the chat. Hang on. I just lost it. I had it and I lost it. Sorry, I have trouble thinking and talking. Okay, there you go. Yeah. What was your question again? Sorry.
Rural, has this been tried in rural areas?
I like that question. So, as you know, range is increasing. And I did work with a group, and I am in communication with Healthy Start organizations in different counties. And so the end of last year, there was a discussion about trying to bring Green Cars for Kids or a program like it to Hendry and Glades County. Those are very rural. That's a great example where maternal and child health outcomes are very bad. There's a huge problem with hospitals all over America. You all, I'm sure, are aware of this, closing. So birthing hospitals are closing, and so women don't even have a place to deliver, much less to get adequate prenatal care. So I looked at trying to see, is that feasible to use electric vehicles in rural communities? And I think with really good planning and maybe even working, this would be a great thing to explore. And I've been trying to connect with charging installation companies. There are a lot of different ones that supply software for charging stations and the ones that install it. Working with one of them to bring the Green Cars for Kids to rural areas to help with this expansion of charging installation in rural areas. You're so right. And I think Alabama would be a wonderful pilot because it's already up and running. Mercedes supplies the cars to my colleague at Kid One and has for over 20 years. So I think they should, and I've mentioned it to them, suggest trying this out with electric cars because they drive very far distances. Another area here in Palm Beach County, where there is so much wealth, I learned that in the Glades community, there is no birthing hospital within 45 minutes, and not even that, there's no prenatal care right now. They lost their last clinician who provided that. So there, it is a desert in my own county that has a lot of wealth. And so I'm talking with partners that work in maternal and child health to bring Green Cars for Kids to the Glades community, because I can imagine they're not getting much or any prenatal care. And I can imagine possibly even delivering outside of a hospital. You can only imagine if it takes 45 minutes to get to the hospital, and that's not good.
Other questions for Dr. Toms?
I have a quick question. First of all, this is so amazing. I love your project so much. I wanna connect you with Pam Brown EO from the NAACP in Miami-Dade. And I guess, is there anything that we can help you expand? Is it mostly finding funding? Has that been difficult? What have been some of the roadblocks?
Okay, thank you, Laura. I would love an introduction to Sam. That would be great. So the primary roadblock has been funding. It's a new organization, and it takes gutsy organizations that really understand the problem, like the March of Dimes, to back something like Green Cars for Kids. And now the Health Foundation, Jackson Memorial, And March of Dimes will be working together to build things out here. And March of Dimes wants to expand also nationally over the next 5 years, because there's a need in California, there's a need in Ohio, there's a need in Georgia, and South Carolina, pretty much everywhere. So I'll be working closely with them, but also the American Heart Association is really focused on social determinants of health and maternal health, because over a third of maternal deaths are hypertension or heart disease related. So they are very interested. There's lots of as you know, federal funding available through the EPA and the Department of Transportation for clean transportation projects. I just need to be able to partner with larger organizations and also municipalities, counties, maybe even the compact to address this. That would be a great help. And, you know, just convincing clinics. That's been a problem with Kid One. They've had lots of funders, but the clinics are, for some reason, a little slow to act, even though they're the ones who stand to benefit the most economically, because those no-shows are very costly to clinics. Yeah.
Dr. Thomas, I was curious about the cars, the drivers. Are they owned, and do they work for this nonprofit?
So I was told by Russell, the founder of Kid One, if I could work with another provider rather than organizing that myself. And we were working on doing everything ourselves with the hiring the drivers and everything. And I came across a stumbling block called automobile insurance and liability insurance in South Florida. So I reached out to an organization that I thought seemed very similar, like Freebie. I called them to ask them about their insurance. And then we started conversations and talking, and we saw that even though they're a for-profit company, our interests are very closely aligned, because they also work with municipalities to address things like food deserts. For example, in Florida City and Miami-Dade County, that's a food desert with a lot of agricultural workers. They provide transportation for those agricultural workers to the closest, I think it's a Publix. So they're already working on social determinants of health. So we partner, and so they handle all that. So I can really focus on the program, the videos, the parents, everything they need. There was a woman who had an episiotomy that was very uncomfortable. We got her a special cushion the next day. If it would be very hard to do that if I didn't have the flexibility that working with Freebie provides. And they have the ability to scale much quicker, because they work with municipalities all the time. They know the permitting, they know all of that. So we are looking to expand with them, but it's not an exclusive relationship. So I'm open to working with other organizations too. But I really recommend Freebie. They have a lot of integrity.
Great. Other questions? Don't be shy.
Thanks, Laura. I appreciate that. Hollywood Birth Center. Okay.
Yeah, let's connect. I have a lot of ideas from having been a mom recently, and I had to change providers so many times. I went through my own little things too. So yeah, let's have a conversation. I know of some places that I think would be happy to provide this service. Or
Oh,
yeah,
that's wonderful. Well,
make connections.
I would
we'll
think
do that.
hospital foundations would be all over this. You would think.
Yeah, so the March of Dimes also supports, I think it's in Maryland and maybe Pennsylvania, there are 3 or 4 mobile clinics. And their largest funder is insurance companies, because it also helps reduce their costs. You know, it's much cheaper to fund, you know, providing prenatal care and transportation for these women than, you know, a 6-month stay or even a 2-day stay in the NICU, you know, for babies. And also if a mother has a catastrophic event with preeclampsia or eclampsia, that can be costly with her admission too. So it's a no-brainer, like you said. Yeah.
Mhm. Yeah. Hey, Steve.
Yeah, I was curious as to how much money it takes to start up, and what is the budget for this 2-year project? Do you do an
Right.
annual budget and then another annual budget?
So I've submitted a 2-year budget together. And so that breaks down for 2 cars, yearly about $230,000. Yeah. So you know, my work is volunteer, and it's something that has become a part of who I am. It's my 3rd child. I have 2 human children. So really, we're able to focus the vast majority of the funding we receive from the March of Dimes and that we're anticipating in April from the Health Foundation and Jackson Memorial and other funders going to the program. I mean, you know, for every woman that gets this ride, we are making a difference. And also there was a study, I didn't tell you all, that came out last year that showed locally, if you can, per 1,000 residents, if you can replace combustion engines, internal combustion engines with electric ones, you can reduce, if you can replace 20 cars, I'm not saying that well, 20 internal combustion engine cars with electric cars, you can reduce air pollution by over 3%. And that's just 20 cars. So imagine our future, because we're going to make this transition. We will. And imagine our future. And next time you're walking next to a car that's stinky and polluted, know that that will stop to exist. And maybe our children and our grandchildren will look back and say, hey, can you believe they did that? So I'm excited about the future because I know it's going to